I've been a doctor for 35 years, so for 35 years I've had to deal with paper notes. So it's great that Clatterbridge is now introducing a single record available for everybody, all legible, all clear and all up to date.
It's extremely important for nurses to have information available to us swiftly, 24 hours a day, 7 days a week. The ward that we work on means that we have patients that are coming in out of hours, are having access to their medical notes, correspondence from other hospitals, from their GP. Swift access to most recent blood results is vital.
Meditech will link quite closely with the ARIA radiotherapy system, and that will mean that we can get patient demographics and appointments across from the Meditech system into ARIA more efficiently.
The problems we're facing in radiology at the moment is we have to wait for the request forms, so we have a bit of a delay, whereas there'll be no delays when we have the Meditech system in place.
In the first phase, what we're looking to do is replace the Maxims, the Ascribe and the Exceptionist systems by one single system Meditech, one smoother and slicker system.
When we all get used to it, I think it'll be so much quicker, and we won't be chasing tests, we won't be chasing things, it'll just be all there and will make my job easier.
Initially the functions will be very similar to what we've seen in our previous systems, but there will be some enhancements and there will be some changes in our current workflows that will mean that we can remove paper. For me, the implementation of an electronic patient record is all about patient safety. If we look at examples such as the identification of sepsis, prophylaxis of venous thromboembolism, again, electronic patient records can ensure that we do the right things at the right time and reduce risk for our patients.
One of the key points for us is that we will be accessing the patient's record in an integrated system. So rather than having to switch between systems, everything should be in the same software.
It will make things so much easier that we'll be able to liaise with other computer systems from other hospitals as well. So at the moment, if we needed blood results, for example, from the Royal, we have to phone up and get those results over the phone, whereas when the new system comes into play, they will link up together, so we'll be able to access all of that information.
At first there's going to be some challenges to face, but I think we all need to remain positive and look to the future, and it'll really help for everyone to stay positive, come to the training, make sure that you keep informed as well by your experts just what's happening. Any questions that you might have and any concerns, raise with the specialists from your area, that's what they're there for. But if we all get behind it, it's going to be a really good system and it's going to be beneficial to the trust as a whole.
Clatterbridge is in the middle of a huge, ambitious programme called Transforming Cancer Care, and the EPR is a huge part of that ambition. This will help us realise our dream of Clatterbridge being a world-leading cancer centre.